Here's a patient who has bilateral nephrostomy tubes. You can see the tubes coming here on the left, and then another tube comes in on the right, and these are percutaneously placed. So these are percutaneous nephrostomy tubes. And the pigtail catheters you can see are looping within the renal sinus bilaterally. Now this patient here, you can see there's actually quite a lot of fat within the renal sinus on the left as well as on the right, in the setting of thinned renal cortex. If we look at the cortex here, we can see it's quite thinned in multiple areas. And so this is a patient who has chronic kidney dysfunction as well. This patient has had long-standing chronic infections as well as ureteral strictures, and so this is the reason why they have the nephrostomy tubes. Now, in the setting of a large amount of fat within the renal sinuses bilaterally, the main differential diagnosis for this is renal sinus lipomatosis and renal replacement lipomatosis. This is an example of renal replacement lipomatosis. It's a more advanced form of renal sinus lipomatosis where the fat actually replaces the renal parenchyma. So you see this in the setting of thinned or absent renal cortices, and especially in the setting of infection or chronic infection. So when you think about renal sinus lipomatosis, usually it's normal appearing kidneys with a large amount of renal sinus fat. When you start seeing renal thinning in the setting of chronic infections, you think about renal replacement lipomatosis.